morning guys, I'm Logadharshini from first year 104B. I'm going to talk about bradypnea. Bradypnea is an abnormally slow breathing rate. So basically normal breathing rate is 12 and 20, which is normal. Below 12 breaths per minute is abnormally slow. Above 25 is faster. So basically adult, this is generally defined as a respiratory rate fewer than 12 breaths per minute. While at rest, it is important to note that the normal breathing rates varies with age. With children typically have faster rates than adults. Bradypnea indicates that the body may not getting enough oxygen or may be retaining too much carbon dioxide. Causes of bradypnea arise wide range of underlying conditions affecting different systems of the body. Neurological issues, the brainstem located at the base of the brain controls the breathing. Condition affecting this area can disturb normal respiratory function. Head injuries, traumas to the head, especially near to the brainstem. Brain tumors, growths that put pressure on the brainstem. Stroke, destruction of the blood flow that to the brainstem. Stroke, increased intracranial pressure, swelling or fluid buildup in the skull. Neurological disorders, conditions like multiple sclerosis can sometimes affect the breathing control. Medication and substances, certain substances can depress the central nervous system, leading to the slow breathing. Opioids are powerful medications that can significantly cause a slow respiration. Overdoses are particularly dangerous. Sedatives and anesthesia drugs used for the relaxation, anxiety, and during the surgical procedure. Alcohol heavy consumption can also depress respiratory drive. Barbiturates are a class of a sedative hypnotic medication. Muscles relaxation. Some can have a sedative effect and slow breathing. Metabolic disorders. Imbalance in the body chemistry can affect breathing. Hypothyroidism and underactive thyroid gland can slow down many bodily functions, including this respiration. Electrolyte imbalance, abnormal levels of minerals like potassium, calcium, and sodium can interfere with the nerve, muscles function, including those involved in the breathing. Cardiovascular issues, the heart and the lungs both work closely together. Problem with one can affect the other. Heart failure, the heart inability to pump the blood effectively can lead to the fluid buildup in the lungs and alters the breathing pattern. Severe bradypnea slow heart rate. While distinct from bradypnea, very slow heart rate can sometimes be associated with the changes in the breathing. Respiratory condition indirectly, while less direct, or some severe lung conditions can lead to a compensatory slow and shallow breathing patterns in an attempt to conserve energy or manage oxygen and carbon dioxide level. Exposure to the toxin, certain inhaled substances can interfere with the body ability to breathe normally. Carbon monoxide poisoning prevents the blood from carrying the oxygen effectively, which causes bradypnea in either way. Other toxic inhalants, some industrial chemicals can have a respiratory depression effect. Other factor, sleep apnea, while characterized by pauses in breathing, some individuals may have overall slower breathing rate between apneic episodes. Extreme cold exposure, hypothermia, can slow down our breathing bodily function, including the respiration. Aging, in some older adults, respiratory muscles may weaken, leading to slightly slower breathing rate that is not necessarily pathological. High altitude cases, like initially breathing may increase the high altitude, but the body adapts in some cases. A slow, deeper breathing pattern can develop within the time when they start living in that phase. Stress and anxiety. In some studies suggest that link between long-term stress, anxiety, altered breathing patterns, including bradypnea in some individuals. Symptoms of bradypnea is associated with can vary depending on underlying cases and the severity of the slow breathing. Slow breathing rate, the most obvious sign, fewer than 12 breaths per minute in adult. Shortness of breath, which is called as dyspnea, feeling like you cannot get enough air, dizziness and tiredness due to the reduced oxygen supply to the brain, confused or altered mental status, also reduced decrease of oxygen to the brain, fatigue or weakness, feeling unusually tired or lacking strength, lethargy, a state of drowsiness, inactivity and reduced alertness, cyanosis, bluish discoloration of the skin, lips and nails, bed, indicating low blood oxygen level, a more severe symptom. Headache can occur due to the carbon dioxide buildup without the oxygen insufficient. We can even observe the symptoms like chest pain may be present if underlying causes in the cardiac related. Fainting or near fainting, syncope, in severe cases reduced oxygen flow. Sleep problems can be associated conditions causing the bradypnea such as sleep apnea. Nausea and vomiting may occur depending on the underlying causes such as medication, side effect or increased intracranial pressure. Treatment of bradypnea. So basically our primary goal for the treatment of bradypnea is to identify and address the underlying cases which are caused in this. So basically discontinuing or adjusting medication. If the medication is identified as the cause, the doctor may lower the dosage, switch to the other alternative drug or discontinue the medication altogether. Otherwise they undergo many different kinds of diseases too, like hypothyroidism. Thyroid hormones replace the therapy, electrolyte imbalances, correction of the specific electrolyte deficiencies, cardiac conditions, medications, pacemakers in case of severe bradycardia affecting the breathing or other cardiac intervention. Neurological disorders, management of specific neurological conditions which may include medication, surgery or therapy. Sleep apnea, positive airway pressure therapy, lifestyle changes, surgery, infection, antibiotics or other appropriate antimicrobial treatment, supportive care. Supplement oxygen to increase the blood oxygen level and alleviate symptoms of hypoxia. Thank you.